I'm going to talk a little bit about my previous work looking at substance abuse treatment, broadly considered on crime. And this was joint work with Sam Bondurant and Jason Lindo. So we're here to talk about violence, but the quickest and easiest way to motivate this issue is to show you a graph that I think we're all familiar with that looks at drug overdose deaths. So we know there's been an ongoing opioid epidemic. In the last 20 years, there's been a 350% increase in the drug overdose death rate. Nearly 841,000 people have died since 1999 in this epidemic. And provisional data from 2020 suggests that it's ongoing, that overdoses in 2020 leapt nearly 30%, highest ever recorded. And this is, the causes of this are varied: prescribing behaviors, availability of new drugs, aggressive pharmaceutical marketing, concerns about chronic pain, doctor shopping, all sorts of things underlying this. And drug overdose deaths are certainly not the only drug-related harm because of the opioid epidemic. There's a clear link between drugs and violence. And in the context of this paper, there's a clear need for treatment. So in the United States, over 20 million in the US have a substance use disorder. Not many of these people receive treatment. 80% of those abusing an illicit substance didn't receive treatment. 70% of arrestees have never been in any form of drug or alcohol treatment. And drugs are an underlying factor in a lot of criminal incidents. I think the total cost of drug-related crime is estimated at over $60 billion. And this isn't just crimes related to possession and sale. This is violent crimes. And so some of the mechanisms we like to think of when we link drugs and crime include psychopharmacological effects. There's the consumption of drugs directly leads to aggressive or elevated behavior that could be prone to violence. You can also think of economically compulsive effects, where addicts are seeking out funds to buy drugs, and the crimes they commit can have violence involved in them. There's also systemic effects with these underground drug markets and the dangerous supply chains. There's situations where there's violence among and against those associated with the drug trade. So as a society, we have to think about how to best reduce drug-related harm, such as this crime and violence that is a result of it. And as economists, we immediately go to our supply and demand graphs and figure out what are the different implications for either demand or supply side policies. So I'm not going to dive into these supply side policies much, other than to say there's a large literature. And I think if we summed it up broadly, we could say that where effects are found for supply side policies, they're often temporary. So we're thinking of law enforcement, market regulations, other supply side interventions, precursor regulatory environments, interdiction. That's not to say that there isn't encouraging evidence that supply side efforts could work, but I think broadly we've spent a lot of money on the war on drugs, and supply side policies are often mixed in terms of their results. More to the focus of this paper that I'm going to tell you about is demand side policies. So these are policies that can reduce drugs, reduce the quantity of drugs consumed, and thus the drug-related harms through prevention or treatment or information campaigns. And it's focusing specifically on treatment. There's a large literature that suggests treatment can be very effective. Most of this comes in the form of clinical trials evidence in the medical literature. So this is usually small studies focusing on particular modalities, often focusing on drug abuse because less frequent serious outcomes such as crime are often beyond the scope of these studies. But these studies suggest that all major modalities of treatment are effective in at least reducing drug abuse. In terms of larger scale, kind of broad considerations of substance abuse treatment, there's some evidence using observational data that reflects kind of the effects of substance abuse treatment across the United States. I have some work that shows expanding access to treatment through increasing the number of treatment facilities significantly reduces drug-induced mortality. There's a recent working paper that really pins down the timing of openings and closings of treatment facilities and shows there's a strong link between ER visits and these openings and closings. So getting onto this paper that I'm going to talk specifically about, our goal is to quantify the effects of treatment expansions on community crime. And we're going to do this by looking at the openings and closings of these county substance abuse treatment facilities across the US. And I think it's important to note that these treatment facilities are the primary method whereby substance abuse treatment is delivered in the United States. So you can think of it as a very useful policy lever of sorts when we're thinking about these treatment facilities. So we will go into a lot of the detail on the data, but we have data on these treatment facilities, drug-related deaths. We have and crime data from the FBI. I won't go into the technical details on how we operationalize this, but I think you're all aware that economists obsess about credible, valid causal estimates. And this setting is a little different than what Aaron just talked about. It's not a randomized controlled trials. It's a look at a whole bunch of different treatment facilities opening and closing, and we don't know why. Often each facility is opening, so it's a little more effort, I think, to convince people that this is credible, this is valid, this is causal. And so just to highlight a few of the things that we do to kind of reinforce the validity of the estimates, we expose it to all sorts of robustness checks. We pin down the timing of the openings and closings of these facilities to make sure it all lines up with the outcomes in the way that we think would make sense. We look for the greatest effects in the areas where we think that are closely linked to drug abuse. And we show that when you expand these facilities, it actually does increase admissions, which makes sense if it's going to subsequently affect drug-related harms or drug-related crime outcomes. All right, so I'm going to jump to some estimates here and just show you our main findings. So we first looked at homicide using several different data sets. First data set, I'll just focus here on column 5, is using county level mortality files. The second data set looking at homicide is from the FBI, and it's more of a municipal level data set. So when a county experiences an increase in the number of substance abuse treatment facilities, this estimate tells us that intentional homicide mortality rates are reduced by approximately 0.25%. And I'll unpack that for you in a moment. And at the municipal level, that estimate is 0.16%. And so to quickly kind of run through the effects on some of these other crimes, with homicides, not much for sexual assaults, a little decrease, some evidence for a decrease in aggravated assaults, not much for simple assaults, reductions in robbery, motor vehicle theft, burglary, and not much for larceny. So kind of to recap our main findings, we show that these treatments, expansions in treatments reduce the most costly of crimes, which are homicides, and also some other crimes as well. So the next thing we do in the paper is we spend a lot of time trying to kind of unpack what this means. This is a very broad look at substance abuse treatment in the United States. And we rely on previous literature that has tried to estimate the total social costs of crime for the different types of crime incidents. And we use that data to back out or run a back of the envelope calculation for our results and conclude that an additional substance abuse treatment facility in a county reduces county crime costs by approximately $2.9 million. So to add to that, if we take into consideration the reduction in drug-related mortality associated with expanding treatment facilities, that number jumps up to $7.65 million. So the reduction in terms of drug-related mortality and criminal activity around $7.65 million. And this is, of course, probably just a small glimpse at the total benefits to society of having substance abuse treatment available for citizens. But even just with these outcomes considered, it's clear when you compare it to the average annual cost of substance abuse treatment facility, operating costs of these facilities at $1.1 million, that this seems like a very worthwhile investment. So just to conclude, our results show that there are broad-based benefits to expanding substance abuse treatment in terms of public safety. And this stands in contrast to maybe some of the not in my backyard arguments that you've heard that are used to hinder attempts to expand access to treatment. Thank you.